The purpose of this assessment is to determine if there is a relationship between the percentage of the population that reported they understood the care they need after leaving the hospital, compared to the percentage of the population for the race categories at the county level. For the data visualization, it is recommended that you enter full screen mode by clicking the icon in the lower right corner. The upper left table of this dashboard shows the percentage of patients that strongly understood the care they need after leaving the hospital for each state. This is also depicted in the map in the upper right. The relationship of this metric is displayed on the bottom between various metrics related to the percentage of the population that fall into race categories for each county in the US. Using this dashboard, we can filter data to a selected state. For instance, if we selected Minnesota from the table on the upper left by scrolling down and choosing MN, we see that just over 56% of the population understood the type of care needed. When looking at the relationship of this variable by race category, we find that those in counties with a higher percentage of the population that is white, there's a higher rate of the population that understood the type of care needed. However, the other race categories show a slight trend towards the opposite. That is, in counties with a higher percentage of other race categories, there's a slightly lower rate of the population that understood the type of care needed. Minnesota had a relatively high rate of overall understanding of care needed, so we can compare this to a state where there is an overall lower percentage of the population that understood the care they needed. We will select New York from the upper left table. Here we see the overall percentage that understood their care is 48.7%. When examining the relationship of this variable by race category, we find that the trend is slightly different, with the percentage of the population being white still showing a positive relationship with the rate that understood care. However, this relationship doesn't appear as strong. The same can be said for some of the other race categories. The use of this dashboard can reveal trends related to understanding care and diversity. This data can be used to better approach the care of the population to ensure a greater percentage are leaving the hospital with a good understanding of the care that is needed to maintain health.